Hi everyone, welcome back to my channel. This is Dr. Farida Rajan Ibrahim Omasundi, and today we are going to discuss premature rupture of membranes. We are going to look at the risk factors, symptoms, as well as diagnosis and preventive measures. If you are new or you haven't liked, please do like, share and subscribe. So what is premature rupture of membranes? So this refers to the rupture or sudden breaking of the fetal membranes before the onset of labor contractions. And when this occurs before 37 weeks of gestation, it is called preterm premature rupture of membranes. So what is the classification? So mostly the classification can be term PROM, which occurs at greater or equal to 37 weeks of gestation but before the onset of labor. So that is term premature rupture of membranes. We also have preterm premature rupture of membranes or PROM. This one occurs less than 37 weeks of gestation. We also have prolonged premature rupture of membranes. This occurs when the membranes have been ruptured for more than 18 hours before delivery. So what are the etiological factors or the causes? So the causes can be multifactorial, and the common ones being 1. Infection. Infections such as bacterial vaginosis, chlamydia, gonorrhea, streptococcus group B, or UTIs can weaken the membranes. We also have factors such as mechanical stress, due to things such as multiple pregnancy or polyhydramnios where there is excess amniotic fluid, or cervical incompetence causing mechanical stress, thereby leading to PROM. We also have things such as structural weakness of the membranes, or some procedures, for instance in late pregnancy if you carry out a lot of vaginal examinations. We also have factors such as smoking, poor nutrition, low socioeconomic status, or previous history of a premature rupture of membrane can also be a cause or a risk factor. So what are the clinical features? So the clinical features include the main symptom mostly is a sudden gush or continuous leakage of clear fluid from the vagina, and the symptoms include sudden fluid leakage, the vagina, which may be clear, straw colored or slightly blood stained. So this woman will come in with feeling of wetness or soaked underwear, decreased fetal movements, especially if oligohydramnios develops, and sometimes they will come in with complaints of no uterine contractions initially. And what are the signs? So the signs include things such as pooling of fluid in the posterior vaginal fornix on speculum examination. There will be a positive nitrazine test as well, where the fluid turns blue due to alkaline pH. The FEN test include things such as arborization pattern on microscopy. And you should note that any digital vaginal examination should be avoided until labor begins to prevent infection. So what are the investigations? The first investigation you can do is a speculum examination to confirm fluid leakage and check for infection. Mostly can be discharge or odor. You can do a nitrazine paper test, which will detect alkaline amniotic fluid where the paper will turn blue. You can do the FEN test where the amniotic fluid dries in a FEN-like pattern under the microscope. You can also carry out an ultrasound to assess the amniotic fluid volume, to check the fetal well-being and determine presentation and gestational age. You can do a full blood count. You can do a high vaginal swab. You can also do a C-reactive protein, which will monitor maternal infection or inflammation. So what are the complications? So I'll divide the complications into maternal as well as fetal. For maternal, you can have things such as chorioamnionitis, which is inflammation of the membranes. You can also have endometriosis, which will occur postpartum. You can have sepsis as well as preterm labor. And for fetal complications, you can have things such as prematurity and associated complications such as sepsis. You can have cord prolapse, umbilical cord compression, oligohydramnios, pulmonary hypoplasia, and fetal death in severe cases. So what is the management? Mostly, the management will be divided according to the weeks. So at term, if this pregnancy is more than 37 weeks, you induce labor if the spontaneous contractions do not start within 12 to 24 hours. You also monitor for infections, such as you monitor the temperature, the pulse, the fetal heart rate, and you also give prophylactic antibiotics. You avoid repeated vaginal examinations, as we already said. And if it's preterm premature rupture of membranes, where the pregnancy is less than 37 weeks, the management depends on the gestational age and the infection status. So if it's less than 34 weeks and no infection, you hospitalize for observation. You administer corticosteroids to enhance fetal lung maturity. You give antibiotics to prolong latency period, and you monitor daily for infection signs and fetal well-being. If the pregnancy is more than or greater than 34 weeks or infection develops, delivery is indicated. IV antibiotics and labor induction are also indicated. If chorioamnionitis is suspected, here you would carry out an immediate delivery regardless of gestational age. You also give broad spectrum IV antibiotics. So how do you prevent this? Prompt treatment of genitourinary infections, avoid unnecessary vaginal procedures, adequate antenatal care and nutrition. You have to avoid smoking. Cervical sacrilege for incompetent cervix is indicated, and you also give prophylactic antibiotics in high-risk women. So thank you so much. That was a brief discussion on PROM. See you in the next video.